PCOS is the most common disorder in the adolescent girls and women of reproductive age group. Being a lifestyle disease affecting fertility and gem health and no curative treatment for PCOS, is very important to identify polycystic ovarian disease in the initial stage and take necessary steps to stop the progress of the disease. If you take care in the initial phase itself, you can prevent reproductive problems and an array of diseases like diabetes, hypertension, elevated cholesterol, fatty liver, thyroid problems, cancer, uterus, etc. in future. Diagnosis of PCOS in teenage girls and women of reproductive age group is on the rise during the last few decades. Excessive weight gain, more specifically excess fat accumulation in the body, may be the first sign of PCOS, followed by irregular or prolonged menstrual bleeding, excess male pattern hair growth on the face and body, hair loss from the scalp, and acne. If such symptoms are noticed, immediate efforts are to be taken to stop the disease progress and reverse the pathology. Hormonal changes and inflammation associated with the excess fat accumulation in the body is the root cause of PCOS. Imbalance in the production of female hormones, estrogen and progesterone, and excess of estrogen and deficiency of progesterone associated with the absent or delayed egg production is the reason for irregular or prolonged menstrual bleeding and reduced fertility. Excess male hormone production leads to male pattern hair growth and hair thinning on the scalp. PCOS is primarily a lifestyle disorder associated with a sedentary life and high-calorie, nutrient-deficient diet. Optimization of lifestyle with the cell activation support will stop the progress of the disease and reverse the pathology. Burning out the excess fat stored in the body and correcting the body lean mass fat mass ratio and correcting the omega-3 to 6 ratio, which will help to preserve fertility and prevent progress of metabolic syndrome. In PCOS patients, excess fat in the body acts as an overgrown endocrine gland, initiating hormonal imbalance and inflammatory diseases. If the excess fat is in the form of inflammation-inducing trans fat and omega-6 fat, health issues will be more intense, leading to diabetes, other autoimmune diseases, and allergic disorders. Obese PCOS adolescent children are prone for emotional trauma and depression due to bullying from peers and discrimination in society and even in family. Cell activation program for PCOS is basically a clinically monitored and supported lifestyle correction program. It is not possible to correct the aberrant food habit and sedentary lifestyle of PCOS children without the full-hearted involvement of the parents. With the CAP, one can reduce 10 to 20% weight within 3 months, regularize menstrual cycle, reduce excess hair growth, and stop hair thinning and help in regrowth of hair in the scalp. In women trying for pregnancy or on infertility treatment, CAMP help to achieve pregnancy and prevent pregnancy complications like abortion, gestational diabetes, hypertension, preterm labor, etc. In growing children, many a time much weight reduction is not needed, but to see that no further weight increase till the ideal height for weight is achieved. There are no drugs or surgery involved in CAMP, so there are no side effects or complications, and safe for adolescent children. While controlling weight gain, optimized nutrient composition and oxyflex will ensure optimal physical, intellectual, and emotional growth of the child.